To one of my peer reviews on Kelly. Overall, I thought your video was pretty good. You made sure to speak clearly and you were very pleasant towards the patient. You made sure to perform your initial tasks like checking the patient's chart. You provided privacy, used two identifiers to check the patient as well as checking their armband to confirm what they were telling you was true. You washed your hands and you also introduced yourself. I liked in the video how you acted everything out. I think that'll be helpful in the real clinical setting when you have to be up walking around doing those things. You identified the patient's reasons for their visit, and you did ask about their pain level. But in future videos, you should make sure to use a pain scale of 1 to 10 to know exactly where your patient stands when they say they have no pain. Just because patients with chronic pain may say they are feeling normal that day, when in reality they're a 4 on the pain scale. That's definitely something that should be noted in their chart. You did touch on a couple of the neurological assessment tests, but make sure you are thorough in the future and describe their appearance, behavior, cognition, and thought process. That'll be important in your documentation too. And I noticed you did touch on several parts of each assessment area. However, there were a couple objective tests that were missed. Make sure you look over the rubric for the future videos thoroughly before your video and make sure you know exactly what's being tested and why it's being tested, so you can provide a good description of the different areas you assessed. You did a very good job of collecting subjective data from the patient in many of the assessment areas. I know that's something I struggled with in my video, just because I was interviewing my husband, so I kind of know everything and didn't think to ask him. But that'll be important in a clinical setting. Um, I noticed that for a couple of the tests you had just performed them without explaining what the test was and why you were testing it. For example, the Romberg test, you did explain what it was for, but didn't tell us what it was. And I could tell that you knew exactly what you were doing in your head. You just need to make sure that you verbalize it to the audience so you can get all those points on the rubric. Also, make sure to explain to the patient exactly what you want them to do. For example, when you had your patient look in the 6 cardinal directions following your pen light, you should tell them that you want them to follow the pen light with just their eyes without moving their head. That way you can get an accurate test of their extraocular muscles, and they're not cheating by moving their head. You did a good job making sure you checked all the cranial nerves at the beginning of the video. You did kind of skip back to different assessment areas at the end of the video after you assessed the cranial nerves, which is okay. This is like the first video we're doing, so it's really hard to stay in order. But in future videos, I'm sure we'll all learn how to kind of incorporate the cranial nerves and every other test into the specific areas that we're assessing, such as checking cranial nerves 2, 3, 4, and 6 when we're checking the different components of the eyes. And then also like checking cranial nerve 1 when we're testing just inspecting all aspects of the nose and so on. Finally, I know the medical terminology is extremely hard to pronounce. I didn't do such a good job in my video either. But I think we could all benefit from making sure we know what exactly all the different areas we're trying to talk about, what they're called, how to pronounce them. I don't think this will be so important when we're in the actual clinical setting because our patients probably won't understand them, but the professional jargon, but definitely in documentation when we're talking to coworkers or obviously for the videos, we want to make sure that we pronounce everything correctly so everybody knows exactly what we're talking about. Again, I thought your video was very good. You were very confident throughout your whole video and upbeat, which is important. when you're assessing a patient. I think that'll be an extremely good skill that you take into the clinical setting. Not a lot of people have that confidence and aren't as happy as you are in your video, but that's definitely something a patient wants when they're coming in for an assessment, especially if they're not feeling that great. You help them feel better by bringing in a good mood. And you're also very clear and made sure to let the patient know when their assessment was normal, which I think that's important to let the patient know how their assessment's going.